You've probably heard the name Parkinson's disease, right? So many of us have. But what's really happening inside the body and brain? Well, in the next few minutes, we're going to break down this complex neurological disorder. We'll look at the first signs, get to the root cause, and explore the modern strategies for living with it. Let's dive in. See, at its very heart, Parkinson's is really about a communication breakdown. Think about it. What happens when the brain's movement messenger, this vital chemical signal, starts to go quiet? That's the big question we're exploring today, and the answer shows just how much we rely on this invisible conductor for literally every move we make. So, where does this story usually begin? For most people, it's not with some big dramatic event. It's actually with these subtle, almost unnoticeable changes, the very first signs that the body's movement system isn't working quite like it should. So how do doctors even begin to figure this out? Well, neurologists look for a specific pattern of symptoms, what they often call the four cardinal signs. You can think of these as the key clues that when you put them all together, create a really distinct signature of the disease's onset. A really helpful way to remember these four signs is with the acronym TRAP. First, T is for tremor, but it's a specific kind of tremor. It's one that often shows up when the muscles are relaxed, like a tremor in your hand while it's just resting on your lap. R is for rigidity. This is a deep stiffness in the limbs or the torso that can make movement feel really difficult and even cause muscle aches. A stands for akinesia, or its more common cousin, bradykinesia, which basically just means a noticeable slowness of movement. Simple tasks suddenly become slow and take a lot of effort. And finally, P is for postural instability, which affects balance and can lead to falls, though this usually shows up a bit later in the disease. And here's something that's so important to understand. Parkinson's is not just about movement. There's this whole other range of non-motor symptoms that are just as significant. And what's really fascinating and a huge area of research is that some of these, like losing your sense of smell or chronic constipation or even acting out your dreams, can actually show up years, sometimes even a decade, before those classic motor symptoms ever begin. Okay, so we've seen what it looks like on the outside. Now let's go deeper. Let's look inside the brain to uncover the root cause. What is actually happening at a cellular level that's triggering all these profound changes in movement and even mood? Well, the main character in this whole biological story is a chemical called dopamine. The best way to think of it is as the brain's movement messenger. As a neurotransmitter, its job is to carry signals between nerve cells. It's what allows for the smooth, coordinated muscle movements we all take for granted every single day. Everything from walking across the room to just signing your name. And this super important messenger isn't just made anywhere. It's produced in a very specific, very tiny area of the brain. It's called the substantia nigra, which is just Latin for black substance. This little spot is the command center for all our dopamine production. And this slide really gets to the core of the problem. On the left, you see a healthy brain. It's got a thriving substantia nigra churning out plenty of dopamine for fluid, easy movement. But on the right, in a brain with Parkinson's, those dopamine-producing cells are progressively lost. Get this, by the time the first motor symptoms like a tremor even appear, it's estimated that 60 to 80% of these crucial cells have already died off. So as that dopamine supply just dwindles away, the movement message gets weaker and more garbled, leading directly to those TRAP symptoms we talked about. This brings up a really critical question, right? If the problem is happening on a microscopic level deep inside the brain, how in the world can a doctor diagnose it? Well, the process might actually surprise you. Okay, the very first thing to understand is this. There is no single definitive test for Parkinson's. Unlike so many other conditions, you can't diagnose it with a simple blood test or a standard brain scan. This surprises a lot of people, and it really highlights why diagnosis is more of a clinical puzzle than just a simple lab result. So instead of a test, a neurologist basically has to be a detective. They'll do a really thorough review of your medical history, and they'll perform a detailed neurological exam, testing things like reflexes, the way you walk, and your coordination. They're looking for that characteristic TRAP pattern. And maybe the most telling clue of all is seeing a positive response to Parkinson's medication. If the symptoms get better when dopamine levels are temporarily boosted, that's a very strong indicator that it's Parkinson's. Getting a diagnosis is one thing, of course, but living with the condition is another journey entirely. So what does the path forward actually look like? Well, the good news is, while there's no cure yet, there are many, many effective ways to manage the symptoms and maintain a really high quality of life. The key to effective management isn't about finding one single magic bullet. It's really about building a personalized, multidisciplinary team. That means combining medical treatment with therapies, support systems, and proactive lifestyle choices to tackle the condition from every single angle. So, this holistic approach usually has four main pillars. Medication is a big one. The most famous is levodopa. It's a chemical precursor that the brain can turn into dopamine, and it's still a cornerstone of treatment. Then you have targeted therapies: physical therapy for help with balance, occupational therapy for daily tasks, and speech therapy for voice. For some, surgical options like deep brain stimulation can be a game changer. And then underpinning everything is lifestyle, especially exercise and good nutrition.
And I have to say, of all these strategies, it is just impossible to overstate the importance of exercise. This isn't just about general fitness. More and more research shows that specific types of exercise, things like cycling, boxing, even dancing, can actually have a neuroprotective effect, maybe even helping to slow the disease's progression. It is one of the most powerful tools available, period.
So, as we start to wrap up, we've really been on a journey. We went from the external symptoms deep into the brain to find the cause, and then back out to the real-world strategies for living well. And the one thing that connects all of it is knowledge. Understanding Parkinson's, that's the first and most critical step for patients, for families, and really, for all of us. Which leads us to one last and maybe the most crucial question. As science keeps pushing the boundaries and treatments keep getting better, the challenge for the rest of us is a human one. How can we better support the millions of people around the world who are navigating life with Parkinson's every single day? It's a question worth thinking about. Thanks for joining me for this explainer.